the sacral plexus. Its roots are formed by the lumbosacral trunk and the anterior primary rami of the first, second, third, and fourth sacral nerves. The lumbosacral trunk is formed by the fourth and the fifth lumbar roots. It descends directly in front of the ala of the sacrum to join the first sacral nerve The superior gluteal artery leaves the pelvis between these two nerves, while the inferior gluteal artery is seen leaving the pelvis between the second and the third sacral nerves. The internal pudendal artery runs in front of the plexus to leave the pelvis together with the plexus through the greater sciatic foramen. The roots of the sacral plexus lie in front of the piriformis muscle and gives off many branches, the most important of which is the sciatic nerve, which enters the gluteal region immediately below the piriformis. This is the greater sciatic foramen as seen in the gluteal region. It shows the piriformis muscle with the superior gluteal vessels above and the sciatic nerve and the inferior gluteal vessels below. The internal pudendal artery and the pudendal nerve are seen emerging from the greater sciatic foramen. They cross the back of the ischial spine and the sacrospinous ligament to enter the lesser sciatic foramen. This is the levator ani muscle. It forms together with the coccygeus muscle the pelvic diaphragm. It arises from the back of the pubis anteriorly and from the ischial spine posteriorly and from the fascia covering the obturator internus muscle in between. The muscle fibers are directed downwards and medially to gain insertion into the sides of the coccyx and the anococcygeal ligament. It surrounds the anorectal junction. It is further inserted to the perineal body just anterior to the anal canal. It has a free anterior border which curves around the anorectal junction to form the pupo-rectalis part of the muscle, forming a sort of a sling behind the anorectal junction. This is the puborectalis part, curving around the anorectal junction. This is the part of the muscle inserted into the perineal body, just in front of the anal canal. This is the part of the muscle attached to the anal-coccygeal ligament behind the anal canal. The levator is covered on its upper surface by the superior layer of the pelvic fascia and is covered on its inferior surface by the anal fascia, where it forms the medial wall of the ischial-rectal fossa. This is the ischial-rectal fossa. The obturator internus muscle is the side wall of the pelvis, immediately below the pelvic bridge. It is covered by a strong fascia, which gives origin to the levator ani muscle. The obturator internus lies immediately below the obturator nerve and vessels, which pass forwards to enter the obturator canal. This is the obturator nerve and vessels passing forwards. This is the communication between the pubic branch of the obturator artery and the pubic branch of the inferior epigastric artery behind the superior ramus of the pubis. This is the fascia of the obturator internus muscle, giving origin to the levator ani muscle. It forms what is called white line in the side wall of the pelvis. This is the back of the symphysis pubis. This is the most anterior part of the levator ani muscle arising from the back of the pubis. Here, the prostate lies over the most anterior part of the levator ani. Some fleshy fibers of the levator ani are attached to the fibrous sheath of the gland and form what is called the levator prostati muscle.